Hi, everyone. I decided to do my individual proposal paper on the effects of PTSD on memory. The lasting effects of post-traumatic stress disorder, otherwise known as PTSD, has been an item of interest for many psychologists for quite some time. There's a lot of information on how PTSD affects the lives of those who face the disorder. One area that does not have as much research is just how badly PTSD can affect everyday memory. And this piece of information is vital in understanding what those with the disorder go through every day. In this study, we will ask veterans from across the country who have been diagnosed with PTSD, as well as a control group of people without PTSD, to take online memory tests at different times throughout the course of a month. We will compare the data and see if there's a correlation between memory problems and PTSD. I wanted to do a lot of research on this subject so that I had a full understanding of it before I conducted the study. So, in a study from the Journal of Anxiety Disorders, the effect that PTSD has on decision making was looked at. The study looked at 40 veterans who were exposed to very high levels of trauma while serving the United States in the military. These combat veterans had seen things in battle that will forever scar their minds. These veterans were given a variety of memory and decision making tests, and in the end, it was discovered that PTSD does affect decision making. This study is relevant to the research I was conducting because of a small section talking about memory. One of the findings that surprised the researchers was that veterans would have their decisions impacted by bad memories that came up in their mind. They found that the test subjects would even take good memories from their past and create a negative twist to them, making them bad memories. This caught my attention as I have learned that it may be possible for PTSD to not only bring back bad memories, but it can also force the brain to turn great memories into painful ones. The study was able to find that there was a direct correlation between PTSD and decision-making ability. Second study looked at past memories came from the Contemporary Clinical Trials Journal. The researchers in this study wanted to see if positive memory recollection could affect the severity of PTSD symptoms. This study was very interesting to my research because it showed the full circle relationship between PTSD and memory and how they can both affect each other. The study looked at 70 individuals between the ages of 18 and 65 who had PTSD. The patients were tested on two scales for PTSD severity and then were given treatment using positive memory recollection. The study found that this treatment was very successful in relieving the severity of PTSD symptoms in the test subjects. A study I found in the Journal of Psychiatric Research looked at the correlation between both PTSD and alcohol on working memory. Because there's no correlation found in this study between alcohol use and memory, it became relevant to my research in terms of memory. This study looked at 660 adults selected in the United States who were asked to do a variety of cognitive functioning tests. The results of this test showed that while alcohol does not affect working memory, PTSD has a very large impact, especially on working verbal memory. The study showed that those suffering from PTSD have a very hard time remembering spoken instructions, and it can be almost impossible for them to recite these instructions back. Another study I looked at from the Journal of Psychiatric Research also looked at the effect of PTSD on working memory. In this study, the researchers wanted to see if, by doing working memory training, the effects of PTSD can be reversed. This information was incredibly important to my research. A study looked at 130 veterans who were recruited out of the San Diego healthcare system for PTSD, and they were asked to take two tests to look at the severity, and then undergo treatment and take the test again to see if the treatment had any effect. It was found that by doing exercises with working memory, PTSD symptoms can be lowered. There are even cases where patients' results on the second set of PTSD tests showed that they did not meet the requirements for post-traumatic stress disorder anymore. Regardless of how amazing the other articles may be, my research would feel incomplete if I never looked at how PTSD can affect memory loss. An article found in the Journal of Affective Disorders reports researchers hypothesize that memory loss will be much more prevalent in those who have a history of PTSD. The study looked at over 11,000 U.S. citizens aged 35 to 64 who had no history of smoking or dementia. There was a portion of the group who had been diagnosed with PTSD and a second segment that did not have PTSD. The study found that PTSD has a dramatic impact on memory loss. Interestingly, PTSD associated with the 9/11 attack was shown to have the biggest impact. Throughout my research, I noticed that there is a gap in the literature on just how badly PTSD can affect all phases of memory. The study that I will be conducting will use a variety of tests that will give me a larger picture view of how PTSD affects all types of memory and which type will be affected the most. PTSD will have a large impact on sensory memory, short-term or working memory, and long-term memory for those who suffer from it, with the biggest effect being on short-term or working memory. When looking at all three phases of memory, I predict there will be a clear effect from PTSD, but this effect will not be equal. I predict that there will be a 30% short-term memory effect, a 20% long-term memory effect, and an 8% sensory memory impact. It's super important to find participants with no other factors in the study so that we can isolate PTSD as the only independent variable for any memory impacts. Therefore, 200 veterans with PTSD from different healthcare systems across the western United States, along with 200 control individuals from the same area, will be selected for the study. These participants must be between the ages of 18 and 20 and 64 and must have no history of alcoholism, dementia, or smoking. All participants will be asked to complete the study out of the goodness of their heart, as no financial compensation can be offered. Before any memory test can be taken, we first must assess the level of PTSD each participant is going into the study with. In order to do this, we will pay for each participant, including the control group, to take the CAPS-5 PTSD assessment. This assessment is clinically administered and uses a number rating scale from 0 to 4 that ranks the level of severity. 0 means there is no evidence of PTSD, while 4 means there is evidence of extreme or even incapacitating PTSD. In order to make sure the process of this study is as simple as possible, all memory tests will be taken online, with the patient submitting their results into a document that we have access to. The test for the long-term memory will be the Cognifit Online test. This test uses a scale of 0 to 800, with a higher score indicating a better long-term memory. This test is given validity by a study done by the University of Washington. For working memory tests, I'll use the Toolbrain Working Memory Test. This test uses a scale of 0 to 100, with a higher score indicating a better working memory. For the sensory memory test, we use the Sensory Coaches Sensory Type Quiz. This test looks at how well a person's sensory memory works and uses a scale of 0 to 600, with a higher score indicating a better memory. In order for both parties to feel safe, participants will first be asked to sign a release form. Says their information will not be individually released and it will be totally anonymous. Participants will schedule appointments with their local doctors to take the CAPS-5 PTSD assessment, which we will pay for. They will take this test once a week for the entirety of the study. The results will be placed in a shared Google Sheets. Then the 3 memory tests will be emailed out to the participants and they will be asked to become familiar with the tests. The participants will take all 3 tests once a day for 30 days. They will be asked to take the test at a different time each day to eliminate the element of time. Their scores will all be inputted into the same Google Sheet, and I can see how well they are doing on the test, as well as the severity rating of their PTSD. All these instructions will be sent out in emails that the participants will be asked to provide during the selection process. Once the data has all been collected, we can begin to assess just how much PTSD affects all 3 types of memory. We will group the participants' data based on a variety of demographics, such as gender, age, or location, and then find average scores. We will compare the scores of the experimental group to the control, and then we can see the percentage that PTSD seemed to have on their different types of memory. Once this information is obtained, it will be very helpful in identifying which type of memory is affected by PTSD the most. This can help narrow down what treatment to use in order to help prevent memory loss for those suffering from PTSD.